You know, when you think about the visible signs of someone fighting cancer, one image probably pops into your head right away: hair loss. It's become this powerful symbol of the battle. But have you ever actually stopped to wonder why it happens?
All right, let's get right into it. It seems like a pretty straightforward question, doesn't it? You'd think the answer is obvious, that cancer itself, the disease, is what makes hair fall out. But get this, the real story is way more surprising.
Yeah, you heard that right. The actual disease, those cancerous cells causing havoc in the body, they are not the direct cause of hair loss. It's probably one of the biggest misconceptions out there. So, the real culprit here is the very thing designed to save the patient's life: the treatment. The hair loss is a side effect. It's basically collateral damage from the powerful weapons we use to fight the disease. And to really get why this happens, first we got to understand the enemy. So before we can talk about the cure, we need a crystal clear picture of what we're actually up against. What exactly is cancer, and what makes it so incredibly tough to beat? Okay, so at its most basic level, cancer is a disease of runaway growth. Some genetic glitches create these rogue cells that just completely ignore the body's rulebook. They just divide and then divide some more, creating tumors and messing everything up. And that one single characteristic, that out-of-control rapid division, is the key to this whole story. And that right there presents a massive problem. Because these cells multiply at lightning speed, and they can even hitch a ride in the bloodstream to set up camp in totally different parts of the body, well, it becomes incredibly hard to hunt down and destroy every last one of them. And that's why doctors have to bring out the big guns. So, how on earth do you fight an enemy that's hiding among your own healthy cells? Well, for a long time, the main strategy has been to use these powerful broad-spectrum weapons. And the problem is, these treatments can cause a lot of what you might call friendly fire.
This breakdown is super helpful. You've basically got two main strategies. On one hand, there's radiation therapy. Think of it like a sniper. It uses these high-energy beams to take out cells in one specific spot, but it can sometimes harm the healthy tissue right next door. And then you've got chemotherapy. This is more like sending an army through the entire body to hunt down a very specific type of enemy.
Now, while both can cause issues for sure, it's really chemotherapy that's responsible for that widespread hair loss we're talking about. And to understand why, you just have to look at its core logic, which is built on that one thing we just learned about cancer: its obsession with rapid growth. And this right here, this is the simple but kind of brutal logic behind it all. Scientists designed chemo drugs to hunt for one thing and one thing only: cells that are dividing like crazy. And yep, cancer cells do that. But you know what else divides really, really fast in a healthy body? The cells in our hair follicles. The chemotherapy drug, well, it can't tell the difference. It just sees a fast-dividing target and it attacks. And this quote, wow, it really sums up the whole philosophy, doesn't it? When you're fighting an enemy as deadly and sneaky as cancer, the strategy is to accept some collateral damage to make absolutely sure you don't miss a single one of those rogue cells. Hair loss becomes the visible price of that aggressive but often life-saving strategy.
But here's the good news. Medicine is always moving forward. For decades, scientists have been busting their tails to find a smarter approach, to move beyond these scorched-earth tactics and develop weapons that are way more precise, weapons that can actually tell the difference between friend and foe.
And this is so important to remember. Not all cancer treatments are going to make you lose your hair. The new frontier is all about targeted therapies, and one of the most exciting ones out there is immunotherapy. So, instead of pouring a poison into the body to kill cells, immunotherapy is all about waking up your body's own personal army, your immune system, to do the job it was designed to do in the first place. It's a totally different way of thinking about the fight.
But that kind of makes you wonder, right? If our immune system is so great, why doesn't it just handle cancer on its own? Well, it turns out cancer has developed a really clever disguise.
Here's how cancer pulls off its little magic trick. Our immune system soldiers, these things called T cells, have a little checkpoint on their surface called PD-1. And some sneaky cancer cells have figured out how to make their own protein that fits right into that PD-1 spot, like a key in a lock. When that connection happens, it sends a signal to the T cell that basically says, "Hey, I'm one of you, I'm a friend, nothing to see here." And just like that, the cancer cell becomes invisible.
And this is the aha moment. This is how immunotherapy foils the plan. The drug comes in and basically puts up a shield. It physically blocks that deceptive connection. It's literally like ripping the invisibility cloak right off the cancer cell. And once that block is in place, the T cell is no longer fooled. It can finally see the cancer for what it is, a threat, and it goes on the attack.
And the payoff here is just huge. Because this treatment targets a very specific trick used by the cancer cell, it leaves most of our healthy, fast-growing cells, like our hair follicles, completely alone. It's a precision strike, not a carpet bomb.
Okay, so let's wrap this all up and get to the final answer. What's the main thing you should walk away with after all this?
So takeaway number 1. Hair loss isn't caused by the cancer, but by some of the treatments used to fight it. Number 2, old-school chemotherapy is designed to attack all fast-dividing cells, and our hair cells just get caught in the crossfire. It's a friendly fire strategy to make sure no cancer is left standing. And finally, and most importantly, newer treatments like immunotherapy are a total game changer, offering a much more targeted and often less damaging way forward.
So, maybe the best way to think about it isn't as a sign of sickness at all. Maybe hair loss is actually the opposite. It's the outward sign of a powerful, life-saving war being waged inside the body. It's a symbol of the fight for life itself.
And that really leaves us with a pretty deep question, doesn't it? As medicine keeps getting smarter and more precise, we're constantly forced to reevaluate the tough choices we have to make in this war. And it makes you wonder about the trade-offs we're willing to accept to ultimately win.